Competitive employment is the goal, so for us in New Zealand, supported employment is about open labour market employment, so real jobs with real terms and conditions, just as any other member of society. Rapid job search, so again that motivation. When people come to us and say they want a job, that's when they're most motivated to do a lot of work-based assessments, CV development, which is part of the process, but ongoing CV development, group work, preparation means that people wait longer and longer and their motivation drops down. So the quicker we can engage with people and support them to move into active job search, the more they also believe that the service believes that they can work as well. Job finding and all assistance is individualised, so again it's very much about matching the individual to the job that they want, and again we're more engaged as individuals when we find a job that we like doing, and for every individual that's different. Follow-along support is continuous, and again this is a challenge within a welfare benefit system that's now looking at putting timeframes on eligibility and limiting support, or putting post-placement support criteria. And that financial planning is involved, and as we've talked about a lot, the welfare benefit system can be a barrier to people returning to work, so we really need to support people to understand the financial implications, but also how people manage money. We've seen with the recession that middle income group, who used to be okay and just go and spend what they want, have really been impacted, and as some of the other conversations around what benefit do you try and get to, because that gives you the better return with less clawback, we've really got to promote the benefits of working, but actually support people to understand what the financial implications are. So with individual placement and support, and my next two slides are a little bit repetitive, is that there is strong evidence that IPS is the most effective method of helping people with severe mental illness to achieve sustainable competitive employment. And a lot of agencies will be doing the parts of IPS within their practice anyway, but may not be so descriptive or prescriptive around the model. There's been a number of randomised control trials across Europe, including the United Kingdom, Australia and United States, Canada and Hong Kong, and we're beginning to publish some research out of New Zealand. So in Europe, the Sainsbury Centre, which is a large mental health, employment and criminal justice kind of research body, has worked a lot with the Perkins study and done a lot with the mental health and hospital services over there around employment within a mental health context. The Dartmouth Centre in the United States, and a lot of research coming out of Queensland in Australia by Dr. Jeff Waghorn. The IPS approach achieved the greatest success with an average of 61% of participants securing work versus 23% involved in traditional rehabilitation. And I believe the stat is around 12% of people will find jobs without any input anyway. So using an IPS or a supported employment model, as I said, they are similar, should improve people's opportunities by about 50% from just going out and doing it themselves. The one thing that no supported employment agency would ever guarantee would be a job, and again with a lot of the contracts with work and income at the moment, they're looking for 100% outcome models, so that's unrealistic and against the evidence base. So when you look at informed policy making, you should be encouraging people to look at the global evidence around what the success rates will be and not set unachievable expectations which make services unable to deliver, because all you're doing is setting people up to fail, and you'll lose a lot of the expertise around those models of work. Within the individual placement and support model, there is a fidelity scale which allows organisations to assess themselves around how well they're doing, which can be done organisationally down to individual practitioner. So it's a very useful way of, I suppose, measuring quality of practice. And we've looked at the 7 principles of IPS, and that guides Workwise practice. But again, a lot of supported employment agencies will be using very similar approaches. So again, just in terms of the evidence, it's also known as the Drake-Becker individual placement and support model, those randomised controls, again a lot of them in the US, and as I said, there are a number coming out of New Zealand now with Work First down here in Wellington, having produced a report a couple of years ago, and Workwise, and mainly through occupational therapy still, it still seems to have that kind of connotation. So really just to finish on a belief, and we've talked a lot about policy, but I think one of the main things, and people have talked about attitude, is that attitude still limits people accessing service. A lot of people with health and disability issues are told by numerous people that they're not able to work. And that quite often is reinforced by services that are there to support them as well. Within a clinical model, a lot of clinicians still don't believe people with enduring ongoing mental illness can work. And again, a lot of our role, based on our observations and evidence, that work is good for health and that we stand for the positive link between purposefulness and well-being, and that we assist people with health conditions to stay and find employment. And by being attached within clinical settings, we can take good news stories back and help those individuals, those psychologists and psychiatrists who still control a lot of the mental health world, to also believe that people can change and move out of crisis and sustain lives beyond the health system. So I'm going to finish there. I don't know what my time was, but I've said my piece. Cheers. And if anyone's interested in the IPS model a little bit more, I've got a little handout over there called Doing What Works, which is based on a Sainsbury's Centre document but been tweaked for the New Zealand market as well. So it outlines the 7 principles in a little bit more detail. Thanks.